been fractures probably since there've been skeletons. This Allosaurus stubbed his toe 160, give or take 10 or 20 million years ago. And you can see there's callus there, and he was able to heal this despite our not being there. The famous anthropologist Margaret Mead was once asked, what's the first sign of civilization? You'd think she might say, pottery shards or improvised fish hooks or, cave paintings. But she said, no, it's a healed femur, because in the law of the jungle or Hobbes's state of nature of every man against every man, there are no healed femurs, right? Those people are dead. They can't protect or feed themselves. So this means somebody valued that person, cared for them, protected them, fed them until they could rejoin the group. And she said that was the first sign of civilization. So the Stone Age is pretty long, right? It led up until just about 5,000 years ago when we were able to start making, combine copper and tin or arsenic and make bronze. So at that time, we were using just stone weapons and tools, also a little bit of wood, bone, ivory, and horn, although that's not really as well preserved, of course. We use flint for fires, right? So during that time, we were increasingly learning to work together. And that's probably how sapiens beat out Neanderthals, Cro-Magnons, and Denisovians and others. And we gradually created myths, and usually we attributed what we didn't understand to the divine. We did trial and error on herbs and plants, and there was no written language. So this is all oral tradition, passed generation to generation, which is sort of risky, in case somebody dies before they're able to pass that along. They were doing certain procedures like suturing, laceration, using bone and wood as splinters or needles. They used hemp, animal hair, tendon as sutures, and in certain places they even used ants as staples that get them to grab onto the skin, and then they'd twist their necks off and use them much as we use surgical clips now. They pulled rotten teeth, dealt with abscesses, probably set or splint certain fractures and dislocations. And there's evidence from France 7,000 years ago, maybe a forearm compartment syndrome or a transcondylar that went bad, and this poor kid had an above elbow amputation, but there's signs of callus. So he actually survived the operation. I thought that was pretty impressive till Matt Vincent brought it to my attention that they had done a below knee amputation 31,000 years ago, also with signs of callus, and that the patient had survived. One of the weirdest things from antiquity is this idea of boring holes into the skull, and remains of this have been found on multiple continents. And why? Not exactly sure. For seizures, for migraines, maybe for mental illness to allow evil spirits to escape. But again, callus formation, right? A lot of people survived these, and maybe we're being unfair to them, right? Maybe these were for subdurals. And if you think that's weird, well, they were doing it not that long ago. And if you think that's weird, there's still a trepanation advocacy group on the internet if you're interested. So, 10, 12,000 years ago, we started getting into fixed settlements and bigger ones, as time went on, right? And we started to domesticate agriculture and large animals, right? And as we got greater population, there was a division of labor. And one of those specializations was a healer, often a mercurial or odd person in the group who was felt to have a closer relationship to the gods. And remember, the religion and spirituality went hand in hand with medical treatment. Illnesses and injuries were thought to be punishments from the gods. So the healer had to be able to interpret all sorts of signs and symptoms, the movement of birds, animal entrails, the phase of the moon, and then entreat gods on behalf of their patients with different rites and rituals, spells, and sacrifices. On the other hand, there was those who actually did the physical interventions, were not priests and were considered lower in class, those who were pulling teeth and dealing with abscesses and the like, right? And that goes on through the medieval barber surgeon to the bone setters of today, who often had little formal education or training, are still present on multiple continents, right? One big advance about 5,500 years ago was the written word, and they started having these pictographs. They were done for commerce and taxes, as you might imagine. And this was an information revolution because it took away that risky oral tradition. You could document stuff. And because doctors have never really been good at policing themselves, in Babylon, they have this 7-foot tall basalt statue of 282 laws. It's probably it's one of the greatest artifacts of antiquity, a most complete legal compendium, certainly. It's got a code of behavior for medicine that's one of the earliest guidelines of any profession. There's victim compensation, malpractice. Surgeons could lose their hands for a bad outcome. And unfortunately, it's not in Babylon, certainly. It's not even in Iran or Iraq now. It's in the Louvre in Paris, if you want to see it. Not long after that, there was the Edmund Smith Papyrus in Egypt. And this was really the first more scientific than magic treatise. It was a cataloging of 48 cases of different injuries, presented very deadpan as a how-to and what you should take care of and maybe not, talking about reduction and splinting of fractures, that using of crutches, wound management, meat to quell bleeding, honey, hyperosmolar to deal with infections, moldy bread for infections as well. So fairly impressive. So 1,000 years after that, in Northeast India near Varanasi, Sushruta was working, and he was very rational and practical. Did flaps for folks who had their noses cut off as legal punishment. Did styptic cautery. This is alum salts. My dad had one of these things when he'd cut himself shaving. I don't know if they're still around or not, but they were in use even back then. They used wine and cannabis for anesthesia, and he described hundreds of diagnoses, instruments, procedures, almost like op notes, like right from beginning to end. And he was one of the first to say, surgery is not necessarily a last resort. If we can make things better, we should consider that. And, he was translated into Arabic in the 800s, but he's really unknown in the West until the 1800s, when Hippocrates was already seen as the father of medicine. So Hippocrates, just a couple hundred years after Sushruta, was one of the first to see medicine as science, right? Philosophy. Diseases had natural, not supernatural causes. And he did INDs and reductions and surgeries. He, recognized that diet and exercise affected the human body. And we probably know him best for the Hippocratic Oath. So one of the stories from, the Greeks, this was seen as a golden age, with the first democracy and the fathers of Western philosophical thought like Socrates and Plato and Aristotle, but they weren't as advanced in other regards, right? Women were banned from studying and practicing medicine, right? And throughout most of history, women and minorities were often banned from practicing medicine, at least in many areas. So she disguised herself as a man, but was ultimately found out and brought to trial. And there were massive protests, mostly by women. And her sentence was overturned, and the law was repealed. So that was at least a win for that. Now, these scientists, philosophers, use their skills of observation to create theories that they tried to explain health and disease and healing. And they came up with this idea of the 4 humors of blood and phlegm and a couple different types of bile. These all had to be in balance, right? And if they weren't, that you've got an excess of something, you had to let the evil humors out, so that open a vein or put leeches on, which are still in use today. But the bleeding, unfortunately had legs for a couple thousand years. And, George Washington in 1799 woke up with a sore throat, and they bled him down 80 ounces, which is 2.3 liters, and he died. Moving from Greece to Rome, as actually Galen did himself, he was a Greek living in Rome. He wrote a lot. He was a surgeon to gladiators and emperors. He did these vivisection spectacles where he would cut an artery in like a monkey and ask somebody in the audience if they could stop. And when they couldn't, he would ligate it, or do the same thing with it, open their bellies up and have the intestines come out. he wrote a lot, but Roman law forbade human dissection. So he made a lot of errors, but because he had written so much, he had a lot of impact. Now, what the Romans were best known for was their public order, and that allowed for flourishing of other cultural stuff. So here, let me see if these people can say it better than. Well, there you go. So, well, the Roman Empire lasted nearly 1,000 years, but ultimately fell. And when it fell, there was a loss of this centralized control, public safety, as well as a lack of scientific and cultural advancement. Things fell back into, sort of folk remedies, superstitions, people thinking that diseases were punishments from the gods, or from God, maybe. And monks and nuns ran hospitals, but these were mostly hospices, and people tried to avoid them. But even though things had sort of fallen apart in Western Europe, that wasn't true all over the world. This is an early ortho text from the Taoist priest Lin Tao Zhen from the 9th century. Said, this could have been in the last, edition of Rockwood, right? For open fractures, the wound needs first to be enlarged with a sharp knife, see the whole zone of injury, right? Then washed out with boiled sterile water. And finally, the fracture reduced, stabilized by an operation. The wound can then be sutured or not, depending on the situation. So there's the whole argument, open versus closed wound management. So fairly advanced, right? And then not just there, but when the Muslims came onto the scene, they took the Greco-Roman and Indian learning and writings and translated them all into Arabic, and then swept across northern Africa and came up into southern Spain, where Abu Qasis or Al-Zahawi was in Cordoba in southern Spain, and then Ibn Sina was a Persian, actually working mostly in Baghdad, and they did open surgeries for fractures, and they used plaster splints to support their fixation, and then also put together all this learning that they got from all over the world and what they had added to it as well into a 30-volume text called the Kitab al-Tasrif that was used in Western medical schools until the 18th century. I did a little, field work for this talk with my wife just 6 weeks ago. We were at La Mezquita in Cordoba, and this book on the right, Ornament of the World, talks about this culture of tolerance between the Muslims, Jews, and Christians, really a golden age where they really worked well together for a couple hundred years. And then the Crusades and the Muslims came up from North Africa again. And then as that happened and this collapsed, a lot of the Jews and others moved up to Europe to populate the faculties of the newer European medical schools that were coming online in the just after the year 1000. Now, these are medical schools, not surgical schools, right? The surgeons still had their guilds and apprenticeships, so really more medicine than surgery. There were a couple things that helped that came onto the scene as well. Gunpowder had probably been invented a couple hundred years earlier, but as they started getting more and more applications of these, the ballistic injuries are going to be things that surgeons were going to have to deal with more and more. And the distribution of the written word was pretty important. Monks could copy about 40 pages a day, and most of their time was spent copying the Bible rather than other books. But in Asia, they came up with wooden and ceramic and finally metal movable type. And then by the time the Gutenberg press came online, they were able to do about 3,600 pages per day. So as the availability of books went up and the cost of them went down, literacy went up. So, things probably weren't that different in the year 1000 than they were in the year 500, and they probably weren't that different in the year 1500 than they were in 1000, but things are a lot different in the year 2000 than they were in 1500, and that's because this rebirth of thought and advancement. Leonardo da Vinci was studying everything, right? And he, his Vitruvian Man, looked at the proportions of the anatomy, and Andreas Vesalius, the Belgian surgeon and anatomist, his book on the fabric of the human body finally corrected a lot of the errors that Galen had done. And Ambroise Paré, who was originally a barber surgeon, became a sort of a regular surgeon in the French army, was one of the first to note that like hot oil and hot poker cauterization probably was doing more damage than anything else, and figured really advanced the concept of ligatures. He did a lot on prosthetic design as well. And the same Ambroise Paré, as well as Percival Pott 200 years later, actually had open tibia fractures from horse riding accidents. And the normal treatment for the day, that was a baloney amputation to avoid to sepsis and death. But they decided they didn't want to do that. That was good for their patients, but not for them. So you can imagine them saying, well, we sell this stuff, we don't buy it. And that really stayed a common form of treatment, however, until my maybe forebear, John Dunbar, declined that during the American Civil War. Remember, this was the age of exploration. One of the anthropologists working with Cortez and during the conquest of Mexico saw the Aztecs placing sticks in the intermedullary canal for non-unions. And on the right, you can see in the next OR room over, the cardiac surgeons are doing an explant. Once we're getting into the 18th century, you get really the father of scientific surgery. This is John Hunter. He was massively curious. You can see at the bottom all the different things he was interested in. And in order to, there was still a prohibition against dissecting humans. So they had to do grave robbing to get anatomy specimen. And if you haven't been to the Hunterian Museum in London, you should really go. It opens back up. It's been closed for a couple of years, but it opens back up next month. He had this menagerie of animals, and many think that he was actually the inspiration for Dr. Dolittle. Nevertheless, even though Hunter sort of made gentlemen to some extent of surgeons, surgery was still the subject of ridicule and lampoonery, right? It was still more of a risky art than a scientific discipline because there's so many limitations, right? That you couldn't control bleeding. There was no concept of sterility, no real anesthesia, imaging, implants, understanding of fracture biology, and really not much education. But a lot of that would change in the 19th century, right? If pain and bleeding are a problem, then speed is the hallmark of a good surgeon. This Robert Liston was the fastest knife in the West End. He's another Scotsman working in London, and supposedly did a BKs in less than 3 minutes. You've probably heard the story of the 300% mortality where his patient died from bleeding. He cut, one of his assistant's fingers, who then died of sepsis. And then one of the people in the audience was so horrified by the whole affair, they had a heart attack. And then so the mortality was 300% for that. But this guy was not a clown. Like he was a good, respected surgeon. There's still a Liston medal given by the Royal College to this day. Not to be outdone by Liston, our own Lisfranc, who was actually more of a gynecologist who was recruited into Napoleon's Grand Armée, came up with a 10-second midfoot amputation, right? And that's not the only thing. I'm going to spare you an image of the other Lisfranc operation, which was a perineal resection of the rectum for cancer using no anesthesia. Speaking of anesthesia, ether and nitrous were discovered in the late 18th century, but by about the mid-19th century, the era of controlled surgery really begins when Morton uses diethyl ether at MGH in Boston. Now it remains to get things cleaned up, right? This Egot Semmelweis was a Hungarian obstetrician, and he noted that the midwives were causing less puerperal fever than the MDs. The doctors were coming right from, the dissection rooms. They didn't use gloves, and these, young mothers were dying of upper GU infections. So he advised washing hands in a chlorinated lime solution. And he got a lot of backlash from these, arrogant MDs who said, well, doctors are gentlemen and gentlemen's hands are clean. Or, should the executioner file his nails on the way to the gallows, which, is sort of an interesting or ironic analogy if you think about it, right? But he, under the pressure of this backlash, he broke down, was sent to an asylum, and was beaten by the guards, and ultimately and ironically died from an infected hand wound. Pasteur described the germ theory in the 1850s, cleaning these up, heating things to sterilize them. Lister applied this. Lister's another Scotsman. He came up with this carbolic acid spray. The carbolic acid had been used to clean up the sewers and leaching fields in Glasgow, and it didn't kill the cows. So they figured it was okay to do that. So he'd spray this on the patients all around the room, soak the dressings. It's pretty nasty stuff, right? Phenol is a derivative of coal tar and creosote. So, that was ultimately they moved away from that, but the principle remained. The autoclave and then rubber gloves and masks started to come online as well. And finally, by the end of the 19th century, Röntgen described, using X-rays, and within a year of this, many hospitals in Germany had these, and within 3 years, U.S. naval ships. When we were in the Spanish-American War, there were X-ray machines on most of the U.S. Navy ships down there. So, I know a lot of you tucked in towards the end of it, but a lot happened in the 20th century. Albin Lambot is a Belgian. He was a pioneer. He actually coined the term osteosynthesis. He's big on preoperative planning. He recognized that articular fractures needed to be fixed and not anatomically. He was one of the early folks to appreciate the importance of the soft tissues. Maybe you've been in the OR with me when I've talked about Lambot's 7 steps and how this describes just about any fracture surgery. He did leave out, the preoperative plan. He was an advocate of it, but that wasn't one of his steps, right? And by about, the early 1900s, antibiotics arise. The first one is arsphenamine for syphilis. And that even though penicillin was discovered in 1920, it wasn't really used much until World War II for combat wounds and some other issues as well. So, but problems still remain, right? The results of internal fixation were often worse than non-operative treatment because they were usually accompanied by prolonged immobilization, which is the worst of all possible worlds, right? So when you had these things, patients would get joint stiff, they get fracture disease, muscle atrophy, circular dysfunction. So what do, right? The Swiss National Insurance Service complained that if the fractures are healed, why are 70% of the femurs still disabled? And why are a third of the tibia still disabled? So had to come up with another answer. So you got to prevent fracture disease by moving the affected limb. But how do you do that without moving the fracture? So you would come back to operative fixation. And another Belgian, Robert Danis, came up with compression plating using this precursor to dynamic compression, getting rigid fixation and immediate limb mobilization, and getting primary bone healing with osteoclast cutting cones, right? This is around the same time in the 30s that Kuntscher in Kiel in northern Germany was experimenting with intramedullary fixation. He was then stationed in Finland in World War II, and the U.S. and other POWs returned to the U.S. with healed limbs. And, his successes might have kept him from facing a Nuremberg trial, though, he was later nominated for a Nobel Prize for this. Around 1950, Muller, who was a Swiss surgeon, visited Danis, and he understood Lambot's principles, and he started this system for internal fixation using Danis's principles. And he published his results, 75 patients, no complications, right? And then recruited a few like-minded Swiss and German surgeons to put together this guild for the study of fracture fixation, the AO, or Arbeitsgemeinschaft für Osteosynthesfragen. Apologies for my German. Their original principles were an anatomic reduction, rigid fixation, preserving the blood supply, and doing early active motion. So they did this, they had a research lab looking at fracture biology, biomechanics, and implant testing. They got a precision engineer to develop instruments and implants. They had a focus on education so people would do a good job on this stuff, with lectures, hands-on workshops, small group discussions. And it was constantly evolving, putting out publications that captured the current state of fracture care, which now is mostly online, right? And they published their results, right? Because as Churchill once said, no matter how beautiful the strategy, sometimes you have to look at the results. And this is around the same time that D.K. Clausen, the end of the 60s, around 1970 or so, that D.K. Clausen put Ted Hansen in charge of trauma at Harborview. And Dr. Hansen went and visited Kuntscher in Germany before he died, and then brought back this technology and was among the first in the country to do intramedullary nailing. And they published their results. And, the Winquist Hansen Clausen paper in 84 had 520 femoral nails. And, femoral nailing has been the standard of care ever since. But didn't work everywhere. The AO implants didn't always imply AO principles. There were problems with infection, non-union, some disillusionment, particularly in the US, right? Because there's too much of an emphasis on mechanical stability at the expense of biology. So there's a better balance was required. So to improve the biology, figured we had to minimize further devascularization, do fracture fixation that favors healing, right? Doing indirect reduction techniques, decreasing the dissection in the zone of injury, using things like bumps and traction and distractors and the like to maintain that blood supply. And Jeff Metz's book on this at the end of the 80s remains the Bible for this way of thinking. Another thing we thought about is, is an anatomic reduction always required everywhere? Certainly for joint injury, an open approach, direct reduction, and an absolute stability construct makes sense. But maybe hooking that articular block up to the shaft, you can use more minimally invasive techniques, right? Using fluoroscopy and getting length, rotation, alignment, particularly from the mechanical axis of the lower extremity, getting a functional reduction elsewhere, maintaining the blood supply. Also, maybe take a lesson from intramedullary nailing, right? Using relative stability construct that encourage callus, not primary bone healing, secondary bone healing, using bridge plating, which is still stable, less rigid, but still stable, right? And then finally, Stefan Perrin in the lab at the AO lab in Davos found that the osteoporosis under the plates was caused by bone being compressed and necrosed by the plates, not stress protection. So they said, well, why don't we get a smaller and smaller footprint? So they moved from the DC plate to the LC DC plate to these point contact fixers, and then finally to locking plates that didn't even compress the plates to the bone. So maybe did cause less of that necrosis to the bone. So winding down, Brad Henley used to talk about the oops of orthopedics was the future of orthopedics, the osteoporosis, obesity, periprosthetics, and such. I would say that we are well in the era of oops in orthopedics. And if you think about all those limitations that were around in 1800, really sepsis is the thing that remains from those things. We've come up with the osteoporosis, obesity, and prosthetics. And if you want to add one, maybe ballistics, but I think oops sounds better than boops. So we'll stay with oops. So in summary, we have gone from an art based on supernatural forces to an art really based in science. However, the art of caring for our patients remains, and this art of medicine is among the most important contributions to the welfare of mankind.